When you're experiencing strong pain, it can be hard in the moment to decide whether to seek help through convenient care or an emergency department. In this episode of Being Well, I sit down with Carle's Dr. Lavanya Boddu as she explains how to go about choosing the path of care that's best for you.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are welcoming a new guest to the show. We have all the way from Carle, we have Dr. Lavanya Boddu. Welcome to Being Well.
Thank you.
You're so welcome. So as a new guest, we love to get to know our providers, and so do you mind starting by telling us a little bit about yourself?
Yeah, sure. I'm a board-certified family physician. I've been practicing for about 20 years now. I've worked in the ER and urgent cares for the last 15 to 20 years. So that's about, and I have a wide variety of experience with urgent care, ER. I've worked in the hospital as a hospitalist. Yeah. And we take care of wide variety of patients from various age groups like pediatrics to elderly to women's health and adolescents. So now I work for Carle Convenient Care in Mattoon.
Okay.
I'm very passionate about urgent care. That's my field. And Carle Mattoon Convenient Care is excellent. There's nothing we cannot provide in Carle Mattoon Convenient Care compared to any standard ER in the country. In fact, we do more, like a freestanding ER, and we take care of patients who need affordable and accessible health care.
Yeah.
And the most needed population, the rural population. And I'm so grateful for Carle for giving us that ancillary support that we need to provide the care that we can give. And I'm proud to be the part of the rural team here and their vision.
Oh yeah, I mean, as someone who has been born and raised in Coles County, I know how important it is to have access to rural health care. And so being able to watch it grow as I've grown up has been really special. So you've kind of dipped your toe into what our topic is today. We are going to be talking about how someone should know when they are in pain, when they are faced with an ailment, whether they should be going to an emergency department for treatment or to a convenient care. I think probably a great place to start, just to lay the foundation. Can you describe what a convenient care operation is versus an emergency department?
Okay, so let's talk about the patients who have to go to the emergency room.
Okay.
So let's start off from head to toe. Okay, if there's
Sure.
If there's severe headache, confusion, you're having speech problems, weakness, you're worried like stroke-like symptoms, they have to go to the ER. Any traumas have to go to the ER, like any neck fractures, or you're worried about a fracture, you fall from a roof or something like that, or you're in an accident, so that has to go to the ER.
Okay.
So any severe chest pains, like pain radiating to your jaw or arm, you have extensive cardiac history or chronic problems like diabetes and hypertension, that has to go to the ER. or we are worried about a blood clot in the lungs or a blood clot in the legs or something like that, that has to go to the ER. So coming down to the abdomen, if there's a severe abdominal pain, severe nausea, vomiting, dehydration, we are now worried about appendicitis or something like that. That has to go to the ER. Any blood in the urine, blood in bowels, bleeding in pregnancy, or you have like now open fractures from an accident, or big wounds or burns that involves the face and the joints, or foreign body in your ears, or anything like that has to go to the ER. Or pediatric fevers, less than 2 months old with fever in little ones, that has to go to the ER. So, or any acute bleeding from the nose, and you're on blood thinners, that has to go to the ER.
Okay, and so to back up a little bit, so the emergency room, I mean, I know it's got emergency in the name. As we're talking about a variety of different conditions today, in that split second, when you are facing all of this pain, sometimes it's hard to discern whether you should seek emergency department or convenient care. Can you kind of compare, contrast what services those different places offer, why you would pick one over the other?
So, urgent care, you can always come to urgent care. We always bridge that gap to transition the care, whether to give you the appropriate medical health. So we can either transfer you to the ER or we can send you to a specialist as needed. But in urgent care, just to brief you up, we can do a wide variety of things. Anything from colds, coughs, and we take care of vast population, and again, starting from head to toe, we do see pink eyes, ear infections, dental pains, colds, coughs, or neck spasms, or any stable chest pains. You don't have any acute history, but you're having some discomfort in your chest. You just want to rule it out. You know you're okay, but you just feel uncomfortable. You just have that feeling, and you just want to come over and check it out. Yeah, sure, we have all the equipment that's needed for that. Or you have mild asthma exacerbation. You're short of breath a little bit. You're stable enough. You're breathing okay. You can come on in. Same with abdominal issues. You're having mild abdominal pain. You're having nausea, vomitings, you're having mild dehydration, you need some fluids, something like that can come here. Or if there is bleeding in blood in your urine or in your bowel movements, but now it's stopped, you feel okay, you just want to check it out, that's fine. Any skin lumps, bumps, any abscesses, nail abscesses like paronychias can come to the urgent care, or any burns that don't involve the face or the joints, that can come to urgent care as well. And we also take care of minor lacerations, wound care, we do wart excisions, we take care of fractures. We also provide like splints and boots and things like that, and we also provide that transitional care. If you need to go see a specialist, we bridge that gap again, and we also try to find a primary care doctor. So if you're not sure, it's okay to come in. If majority of the time, it's a non-emergent condition. Like if it's non-emergent, if you feel it's urgent, you can't get into seeing your primary care doctor, you feel stable enough, but you want to check it out, you can always, those are the indications to come to the urgent care.
So trying to just kind of use your best judgment between whether you feel like mild symptoms versus severe.
Exactly.
Severe things that are very much in your face, kind of excruciating pain, ER.
ER, yes.
Convenient care, if I can't get into my primary, you all bridge that gap, you said.
Sure, yes.
And so with your all's location, do you have anything, I guess what I'm trying to say is, as far as folks who maybe come through on the interstate, do you ever see people like that who maybe aren't even local?
Yes, that's one of our challenges in urgent care. We see all walk-ins. Majority of our patients are walk-ins, like they travel or they're on a vacation. So we don't have any medical history on much of the medical history. We have to start from scratch. That's always a challenge, especially because we see about 60 patients a day on average, and that's a very fast-paced environment with seeing different age groups and different pathology. And now we are trying to find out their medical problems and medical history and come to a diagnosis and trying to give the best care. So that's one of the challenges we face.
Interesting. Well, and I also gather that sometimes folks, they come in, and I know it'll be individual on a case-by-case kind of thing, but a lot of folks maybe know their body to the extent of, I don't need an over-the-counter. I feel like I would need antibiotics prescribed or something to that effect. Are you able to prescribe medicine from urgent care?
Yes. We do prescribe a wide variety of medications depending on the condition. So majority of the times they can come with sinus infections, ear infections, UTIs. We do provide antibiotics, and sometimes they do come in, they can't get into seeing their primary care doctor. They request for a medication refill for a short period of time. We definitely can do that as well.
And as a provider there, do you have patients that you're a primary care doctor for, or are you strictly for these walk-in patients?
Yes, so Carle Mattoon Convenient Care only sees walk-in patients.
Okay.
But we do, like I said, we do bridge that gap, and we do find a primary care doctor for you if you don't have one, or if you need to go see a specialist, we can arrange for that.
And so as far as people who are coming in to see you all, do you have a lot of patients that come in who should not be there and should have gone to the ER?
Yes.
Can you talk about that?
Yes, for sure. Yeah, for say about 95% of the time we see appropriate urgent care visits, but less than 5% of the time we see severe illnesses like heart attacks, heart arrhythmias, blood clots in their lungs. We see bowel perforations, appendicitis, gallbladder issues. Sometimes we even see like cancers, strokes, cancers of the brain, lungs, ovaries. So we see quite a few severe illnesses in urgent care.
Do a lot of people maybe seek that because it's a cheaper option to maybe touch base with you all first?
Yes, because I think the cost and the wait time in the ER pushes most of our patients, or drives them to come to the urgent care, because we are open 8 to 8, 365 days, and we can do a wide variety of things. Like we have labs, we have X-rays, CT, MRI, or like ultrasounds. So we can do a wide variety of exams to diagnose the problem, and we are relatively faster compared to the ER, lesser wait times, sometimes 0 to maybe 30 minutes to an hour, depending on the day. So comparatively, we are a little bit faster, and we can do a lot more. So yeah, it's an appropriate place for certain conditions.
Sure, and I mean, even just reflecting on time after the pandemic, the entire health field as a whole, just trying to get, you know, people through and served, and it's been a challenge.
Yeah, for sure. And if you can remember, at the time during pandemic, all the primary cares were closed. The only clinics that were operating were ER and urgent cares. We have seen quite a few patients wrapped around the clinics to get a COVID test. So urgent cares do provide a wide variety of help to our patients. For example, Carle Mattoon Convenient Care serves 40 miles around Mattoon area. I have seen patients come in, and they're so thankful that we are there in the evening hours, nights, holidays, that we are there for them. That's a big compliment for us and Carle.
Oh, I bet. And so during your time that you've served, both in an emergency level and then also in urgent care, do you have a favorite? Is one of them more of a calling for you?
I think I like both.
Yeah.
ER is little more critical, more hands-on, more critical. Urgent care is a step down, but we still, in Carle, we have those CTs, MRI, we have the ancillary staff to help us and support us. So I don't miss ER as much as when I work in Carle Mattoon.
Yeah, I mean, no less important, of course. So in your time at either, do you have any maybe stories you can share of how urgent care kind of bridged that gap and really helped somebody?
Yeah, for sure. We do that all the time. So we have so many patients who don't have primary care, or somebody who is coming in the highway, or they're visiting the town. They usually come in for some kind of a problem. They have a fracture now. They need an orthopedic doctor. So this is just an example. So we provide the initial splinting, and we try to find an orthopedic doctor and try to bridge that gap and find an appointment for them. We our goal is to call them within the week to find a primary care urgent care doctor or a specialist for them. And if the care is needed to be done right away, then we transfer them to the ER.
And for that transfer, how does that kind of work? Is that call an ambulance over, or?
So if it's transferring to the ER, we do call the ambulance over, but we are affiliated with Carle up north hospital. So we do have an ability to talk to a lot of our specialists with any questions, and we also can do direct admissions to the hospital. So we have a communication team. We can make a phone call, and they'll take care of it. We just have to transfer them to the main hospital. It's patient-driven, patient preference. If they would like to go to a closer hospital, that's what we do. But if they would prefer to rather go to Carle, then we can transfer that care. If they don't have a ride, or if they're critically ill, we transfer them via ambulance. If not, some of them just drive up there.
Fair enough. I always get a little bit curious because there's some instances where I'm like, well, I don't feel terrible, you know, can I save that ambulance fee? And I'm a cheapskate. Can you save that ambulance fee and let my husband drive me up there? So I was just curious how that process kind of worked.
Yeah.
But I understand if you're critical, of course.
Critical, yes.
Let the ambulance, let the pros make sure you're stable. I have a fantastic list here of different conditions. I know you went through some of them head to toe, so if I repeat some, we can kind of skip over those.
Okay.
But I just kind of want your 2 cents of, I think we're starting with the emergency room. So an injury to the face, eye, head, neck, or spine. Can you talk about what that might kind of look like?
So if you were in an accident, motor vehicle accident, or your car accident, you were on a roof fixing something, you fell off, or you're on a bike and you fell off. So those injuries, because head, neck is the main functioning, the brain and the nervous system that goes down the neck. So any major injuries like that they have to go to the ER because they're more critical. We have to make sure there's no internal bleed in the brain or no fractures in the neck that could lead to more complications.
And so then on the flip side of that, if it's something more cosmetic, such as a minor laceration or cut, that's something you guys could take at urgent care.
For sure.
Okay, so we've got both sides of that. Severe headache, because I tell you what, the amount of folks I know who suffer from migraines, is there a way to tell the difference between those two, between going to the ER versus urgent care?
Oh yeah, we see those patients quite a bit also, and we can rule out any strokes by doing a CT scan, which we are equipped with at Carle Mattoon Convenient Care. Yeah. So that helps us quite a bit to differentiate between a stroke or a migraine, plus the history and the presentation, and that helps us quite a bit as well.
Awesome. And so you've talked about chest pain a bit, that if it's not incredibly severe, you can stop at UL first, but if you do those extra testing you offer on site, might need to send you to the ER.
Yeah, that's always what we need to keep in the back of the mind. We do quite a bit in convenient care. We have the ability to do cardiac workup also, but if the cardiac workup is abnormal or some of the labs are severely off, you have to keep in the back of the mind that you will be transitioned to the closest ER for better care. So that's always there.
And then moving on to vomiting and diarrhea. I think this is also kind of tied with severe dehydration too.
Yes.
That fine line of, is this the tummy bug that will not quit, or if it's something more severe? Yeah.
So if you have this intractable vomiting and diarrhea, you feel extremely weak, your blood pressure is low, you're sweaty, you're dizzy, that's a severe form of dehydration, which I think it's better to go to the ER. But we do provide IV fluids in convenient care. If it's a mild vomiting, diarrhea, or stomach flu kind of thing, you can always come here. We can see if it's appropriate, or at least we can start that initial treatment and decide if we can manage it in urgent care or not.
That's interesting. I didn't realize, I guess I wouldn't have thought that you all are doing IVs there as well.
Yes, yeah, we do IV fluids.
Very cool. Let's see. You had mentioned it as well, blood in the stool or urine, but there's a difference between I just may see a spot or continual.
Yeah, so if it's continual, then you have to go to the ER because your hemoglobin can keep dropping, and that's not good. So if you see one time and it stopped, and then something like that can be easily managed in urgent care.
And you had also mentioned the fever in a young person, but there's kind of that age limit that you want to make sure you're especially careful with?
Yes, 8 weeks and below.
Okay.
If they have a fever and it's an infant of 8 weeks or below, that has to go to the ER because we have to do quite a big workup in the ER, just making sure it's not meningitis or pneumonia or some kind of an infection somewhere that's causing the fevers. And that is one thing that has to go to the ER.
And so I've hit a lot on the ER side, moving over to more your side of things. Yeah. So if someone has, let's say, a missed period or UTI symptoms, that's something you all can totally handle.
Oh, for sure, for sure. We have, like we said, we are equipped with labs, CT, MRI, ultrasounds. Yeah, for sure, we can take care of that.
Now, I think this one might be a trickier one. Dog and cat bites.
Yes.
Because I feel like there's a big difference between if the Chihuahua snaps your finger or a German Shepherd comes at you.
Yeah, it doesn't matter.
Okay.
The bacteria is the same.
Okay.
So it's always better to seek help right away. Cleaning the wound is a big thing, and then coming to the urgent care right away. Especially if you have the rabies vaccination history, then it's even more better to come to urgent care right away. You can be seen faster and we'll take care of you. We need certain antibiotics to treat the infection or to prevent it from progressing. But if we don't know the rabies status, and if it's like a stray cat or dog, you probably will need a rabies vaccination and you have to go to the ER.
And on that same vein, kind of talking about making sure the skin or there's no infection, let's talk about skin infections, rashes. You all are able to kind of, take a look at it and maybe know if it's more than just I'm reacting to a new detergent versus something maybe more serious.
Oh yeah, for sure. This time of the year, there's a lot of poison ivy with exposure to grass, and but yeah, for sure, taking a look at it, we'll be able to differentiate between is it an abscess or a rash, or what do we do next, or is it just a presentation from internal abnormality. Yeah, we can definitely differentiate that and take care of it.
That's good, because Dr. Google can be pretty scary for folks sometimes.
Yes.
We're in our last couple of minutes here,
yeah.
And you had mentioned rabies vaccination, but something else you wanted to discuss today as well is the tetanus vaccine.
Yes.
Which I feel like I heard a lot about as a child, but not so much as an adult. Can you fill us in on kind of when should we be getting it? What's the purpose? That sort of thing.
Yeah, so everybody should be vaccinated for tetanus. It's tetanus is everywhere. You cannot. It's there in the environment, and you cannot escape it. So the only way to prevent tetanus is to get vaccinated, and if you have a wound, to clean it really well. Prevention is really important. So we do that once every 10 years, of course, along with the childhood vaccines. And once you're done with that, it's once every 10 years. But if it's a bigger wound or bigger laceration, we do it in about once every 5 years. And all pregnant women in each pregnancy have to get the tetanus vaccine between 27 to 36 weeks of gestation.
Now, is that something my provider would bring up?
Yes, when you have your annual exam and health maintenance visits, they do. But we do see a lot of walk-ins in urgent care who come in with abrasions this time of the year, working outside with nail punctures or splinters, foreign bodies. Yeah. Anytime they come in with those kind of problems, we do address tetanus status and we give it to them if it's needed.
And I kind of wanted to ask about that, because in my notes, it was talking about the bacteria being from soil or manure. I'd always heard, like you said, a nail. Like I've always heard, like rusty items. If you get a cut like that, then it's like it's on. Like, did you get your tetanus shot?
Yes.
But it can also be from soil or manure.
So that's where majority of this tetanus spores are.
Okay.
The bacteria lives there. So it can get contaminated anywhere from the soil. It's in the environment. It's everywhere.
It's out there. Just stay clean and stay careful while you're working.
Yeah.
And So I guess as we're in our last minute or so here, is there any final notes that might be helpful to a viewer who maybe hasn't ever gone to an urgent care facility, convenient care, about maybe why they should consider that as an option?
We are convenient, like the convenient care states, so we are open 365 days, long hours, 8 to 8. And we take care of all age groups, from pediatrics to our elderly folks, and women's health, children. We take care of everybody, and so there's nothing that we cannot handle, like I said, in urgent care. The only challenge that we face in urgent care is we sometimes see severe illnesses that can cause to mortality and morbidity. So diagnosing those kind of illnesses in a fast-paced environment with these wide presentation is always a challenge, but we are used to that pace. We see quite a few patients, so just walk in and we'll take care of you.
Excellent. Well, Dr. Lavanya, you have been such a wealth of information today. Thank you for coming on Being Well.
Thank you. Thank you for having me.
Of course. And we thank our viewers for joining us for this episode of Being Well, and we hope that you will join us next time.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.